The Newcastle COVID control plan is about how we prevent COVID from happening in the city and how we work with partner agencies to be able to do that, but also about how we respond to outbreaks of COVID in the city and new cases and how they spread. Within the plan, there's detail about how we're going to work in wraparound groups to work with particularly vulnerable communities. Care homes are probably the shining example of that, and we know that there's been much greater risk for people living in care homes throughout the pandemic than elsewhere. We now have a wraparound team in place that is working with the care homes, and we've seen risk come down very substantially over recent weeks as a consequence. We're looking as well to work with schools in order to support them and build confidence that the schools can reopen using appropriate social distancing in order to operate safely. But we're working as well with businesses, with vulnerable communities, with faith groups, with ethnic minorities across the city in order to be able to respond and support those groups as they're needed. Now, all of that's underpinned by the NHS test and trace system and by the high level test and trace support, the outbreak control support that we get from Public Health England based at Citygate in the city. We work with Public Health England all of the time very closely, and they provide excellent support to us in terms of managing outbreaks. What we'll be doing in the coming months as we control COVID is working at several levels in order to be able to gel with them around outbreaks and how those are managed. We've defined those at 4 different levels for internal use and for working with our partners. They're green, amber, red, and red plus. A green outbreak would be really quite a simple one. We've seen a number of these already over recent weeks. They're the sort of things that have happened in care homes and which can be dealt with by the wraparound team and by the staff from Public Health England's health protection team. An outbreak of that kind can usually be controlled quite quickly and confined to a relatively small number of people in a particular place. A red outbreak would be a rather larger one that began to have other implications for us. Things that might involve, for example, communications with the staff and pupils and parents at a school or for a broader workplace, and where there was interest from other parties, or maybe even an outbreak which occupied more than one site that we needed to address. A red outbreak would be one that really starts to give us significant problems, where we know that there is, for example, a rising tide of infections that don't appear to be linked together in quite the same way. And in that instance, we need to start working in more detail with our partners over an extended period of time to identify how the virus is spreading and contain it properly. A red plus outbreak would be one that moves to an even higher level. That would be a level at which we would need to call a major incident, and where we'd have to be working with other agencies and probably other districts in order to try and contain it. Within those 4 levels, we will aim to keep anything that happens towards the lower end of the scale by having mechanisms in place for prevention and working with our partner agencies in order to put that prevention in place. In support of that, we're getting better data all the time. That's improving so that we'll be able to look at the way that the virus is spreading, and we're also looking to bring together other data sources, both within the city and elsewhere, that will allow us to think about other proxies for how the virus might be spreading in the community, and the ways in which people in the community are complying with the guidance and support that we're putting in place. We'll be also putting together a detailed communications plan, reinforcing national messages and localizing them, because it's essential that we get across the message both to the public and to our partners what we're trying to do. The more we can work in tandem with one another on this, the more we can work to do it through cooperation and collaboration, the better. Because what we really want is to be able to nip any outbreaks in the bud. We want to keep the level of COVID down, and we want the city to be as free and open as possible. The last thing we want to do is to move back towards lockdown measures, and if we work effectively, we should be able to avoid those. We've changed the governance structures in the city as well, so that now what was the Wellbeing for Life board is the City Futures board. We brought more partners into that board, and that board is now going to oversee both the COVID control plan and the city's recovery plan, so that we can work closely on those 2 allied aspects of how we move back to some kind of normality. There'll be much more detail about the COVID control plan on the website, and we'll be developing that and responding to new guidance, updating it, and ensuring that the wraparound areas are also clearly represented and the sorts of actions that need to be taken in those areas. We'd encourage you to familiarise yourself with that as it becomes available, and we look forward to working with everybody in supporting a move towards some kind of new normality for Newcastle.